It's Matt, the Kiwi physio in France here, and I'm doing my presentation today on the power of words and the use or misuse of the postural structural biomechanical or PSB model and the biopsychosocial or BPS models in clinical healthcare. So what are these models? The PSB model has been the gold standard of postural and structural form for physiotherapists for a number of years now. And according to this model, there is one perfect body posture, and any deviation from this has often been assumed as the cause or at least a predisposing factor for various musculoskeletal conditions. It's been a major determining factor in clinical assessment and treatment techniques. In this picture here, a bit of a sway back posture. Why he has that posture, or does he normally have that posture? Maybe due to the fact that he's a male trying to fit into a small female's wetsuit, but you can never be sure. Maybe it was there all along. The BPS model, the biopsychosocial model, refers to the understanding of how a patient's pain may be affected by a diverse range of factors, from their social context down to their physiological level. Other things to consider are the relationship between the mental and physical aspect of health for the patient themselves. People's bodies and emotions are very intertwined, so if there's anything causing discomfort, pain, or injury on a physical level, likely it'll have an effect on their emotional health as well, and vice versa. There's also the relationship between the clinician and the patient. It can determine the patient compliance and the general mood or attitude that the patient has to reaching and achieving their goals. This picture on the right here is just an example of many different factors trying to achieve the same goal. But if there's poor communication and there's so many different things going on, then it's often difficult for something to go really well. My personal experience with the PSB and BPS models, I found that when I saw postural deviations in some of my patients from this so-called normal or perfect posture, that as a thorough and wholehearted therapist, it was my job not only to rehab their injury, but to correct or perfect their posture as well. So inadvertently, I'd communicate negatively to the patient about their posture or structure of their body and the abnormality of it relative to this perfect model. However, unfortunately, I found this often had negative consequences either on myself or the patient. And some personalities, despite becoming functionally pain-free and healthy, then actually became more focused and very worried about their abnormality because of this belief that I'd communicated that it was going to cause further health problems in the future. So I also experienced reaching upon some of these end-stage rehab at times that as we'd start and try to correct and fix some of these abnormalities relative to this perfect posture, that in the patients there'd either be no difference, or sometimes it would even make them go backwards or make them more painful, which became very demoralizing for me and also quite confusing. The takeaway message: do you need to change your thinking? In the PSB model, is this so-called model of perfect actually normal? Or is this so-called normal actually truly perfect for everyone? In the biopsychosocial model, how have you been using that, or how have you experienced that? And it shows us that there's many factors to their treatment to a person, including their social atmosphere, what's going on and pressure in their lives, their family life, how the pain has been affecting them over a period of time, whether they're doing as well as they thought they would or not as well as they thought they would. And how can you change your communication to best treat your patient holistically, to give them the best chance of being comfortable and reassured in their rehabilitation. So I hope this has encouraged you to speak life and hope and encourage and empower your patients, and to think about the language you use and the power of your words when treating. Thank you very much.